A hernia is a condition that occurs when one of your organs pushes through the muscle or tissue that contains it. Imagine your muscles and tissues as a strong wall holding your internal organs in place. When a weak spot or hole develops in this wall, organs or tissues can push through, creating a bulge under your skin. It's similar to when a weak spot develops in a tire. The inner tube pushes through, creating a bulge in the tire's surface. Hernias can happen anywhere in your body, but they most commonly occur in your abdomen and groin area. Sometimes you can gently push these bulges back in, and sometimes they pop out again when you cough or strain. While some hernias are present from birth, others develop over time due to things like injury, surgery, or repeated strain on your body. If left untreated, some hernias can grow larger, cause serious pain, or even trap organs and cause life-threatening complications. Types of hernias. Each type of hernia has its own characteristics and typically occurs in specific areas of your body. Here are the main types. Number 1. Inguinal hernia. These are by far the most common type, accounting for 75% of cases, especially in men. It happens when part of the intestine or bladder protrudes through a weak spot in your lower abdominal wall. Men are particularly vulnerable to this type because of a natural weak spot in the groin where blood vessels travel to the testicles. Number 2. Femoral hernia. Femoral hernias also appear in the groin area, but lower down than inguinal hernias. This type happens when the intestine pushes through the femoral canal, which is a passage located just below the inguinal canal. These are more common in women, particularly those who are overweight or pregnant. They tend to be smaller, but can be more dangerous because they're more likely to become trapped and cut off from blood supply. Number 3. Umbilical hernia. Umbilical hernias occur around your belly button. Think of your belly button as a natural weak spot in your abdominal wall. These are particularly common in newborns and pregnant women, but they can affect anyone. In babies, they often close on their own by age 3 or 4, but adults usually need surgery to fix them. Number 4. Incisional hernia. This type develops after surgery, where a previous surgical cut has created a vulnerable spot in your abdominal wall. Imagine a seam in fabric that hasn't healed properly. It becomes a weak point where a tear can occur. These can vary greatly in size and may appear months or even years after surgery. Number 5. Hiatal hernias. Hiatal hernias are unique because you can't see them from the outside. They occur inside your body when part of your stomach pushes up through a natural opening in your diaphragm, the muscle that helps you breathe, into your chest cavity. This type often causes acid reflux and heartburn because it affects how your esophagus and stomach connect. Number 6. Epigastric hernias. Epigastric hernias appear in the midline of your abdomen, above your belly button, but below your chest. They're usually small and often involve fatty tissue pushing through your abdominal wall. Number 7. Sports hernias. Despite their name, these aren't true hernias at all. They're actually tears in the soft tissue of your groin area, common in athletes who do a lot of twisting movements or sudden direction changes. Symptoms of hernia. The signs and symptoms of a hernia can vary depending on its type and severity, but there are some common experiences most people share. The most noticeable sign is usually a bulge or lump in the affected area. This might be more visible when you're standing up, straining, or coughing. You might notice this bulge disappears when you lie down or press on it gently. Many people experience a sense of heaviness, pressure, or weakness in the area where the hernia is located. Pain or discomfort is common, especially when lifting heavy objects, bending over, or during other physical activities. This pain might range from a mild ache to a sharp, severe pain, depending on the hernia's severity. With hiatal hernias, the symptoms can be quite different. You might experience heartburn, chest pain, difficulty swallowing, or feel full quickly when eating. Some people find themselves regurgitating food or feeling nauseous. For inguinal hernias, men might notice pain or swelling around the testicles as the hernia extends into the scrotum. A hernia becomes dangerous when it becomes strangulated. This means the protruding tissue has its blood supply cut off. Signs of a strangulated hernia include severe pain, nausea, vomiting, fever, and a bulge that turns red, purple, or dark. This is a medical emergency requiring immediate attention. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Causes of hernia. Hernias develop when muscle weakness combines with increased pressure on the affected area, allowing an organ or tissue to push through a weakened spot. One of the most common causes of muscle weakness leading to hernias is aging, as muscles naturally lose strength over time. Physical strain is a major factor in the development of hernias, particularly heavy lifting without proper technique. When someone repeatedly lifts heavy objects using their abdominal muscles instead of their legs, they put excessive pressure on the abdominal wall, which can cause a hernia to form. Straining during bowel movements due to chronic constipation or persistent coughing from chronic respiratory conditions can also contribute to hernia formation. Pregnancy is another common cause, as the growing uterus puts pressure on the abdominal muscles, stretching and weakening them over time. Women who have had multiple pregnancies or those with excess amniotic fluid are at a higher risk. Similarly, excess body weight can contribute to hernia development, as obesity increases intra-abdominal pressure, weakening muscle structures and making hernias more likely. Previous surgeries can also create vulnerable areas in your abdominal wall, particularly if the healing process was complicated. Diagnosis of hernia. Diagnosing a hernia typically begins with a physical examination. Your doctor will look for visible bulges in your abdominal wall or groin area, especially when you're standing or coughing. They'll likely ask you to cough or strain while they feel the area, as this can make the hernia more noticeable. Your medical history plays an important role. Your doctor will ask about symptoms, when they started, what makes them better or worse, and any relevant risk factors or previous surgeries. Sometimes imaging tests are necessary to confirm the diagnosis or plan treatment. An ultrasound can help visualize the hernia and determine its size and contents. CT scans provide detailed images that can be particularly helpful when planning surgery or if the hernia is in a less obvious location. For hiatal hernias, your doctor might recommend an upper endoscopy or barium swallow test to get a better look at your upper digestive tract. Treatment for hernia. Number 1. Watchful waiting. For small, uncomplicated hernias that aren't causing symptoms, your doctor might recommend monitoring the condition rather than immediate treatment. This approach involves regular checkups to ensure the hernia isn't growing or causing problems. You'll learn what warning signs to watch for and may need to modify activities to prevent the hernia from worsening. This option is often chosen for small hernias in elderly patients or those with health conditions that make surgery risky. Number 2. Lifestyle modifications. While lifestyle changes won't cure a hernia, they can help manage symptoms and prevent the condition from worsening. This includes maintaining a healthy weight, avoiding heavy lifting, quitting smoking, and treating chronic cough or constipation. Your doctor might recommend specific exercises to strengthen surrounding muscles without putting extra strain on the hernia. For hiatal hernias, dietary changes and eating smaller meals can help manage symptoms. Number 3. Support devices. Some hernias can be managed temporarily with special support devices or trusses. These devices apply gentle pressure to keep the hernia in place and prevent it from protruding. While not a long-term solution, they can provide comfort and support, particularly for inguinal hernias. These devices must be properly fitted by a healthcare professional to ensure they're effective and don't cause additional problems. Number 4. Open hernia repair surgery. This is the traditional open surgery, which involves making an incision near the hernia site to push the protruding tissue back into place. The surgeon then strengthens the weakened area using stitches and often a mesh patch to provide additional support. Recovery typically takes several weeks, during which you'll need to avoid heavy lifting and strenuous activity. This approach might be preferred for large hernias or when the hernia has complicated features. Number 5. Laparoscopic hernia repair. This minimally invasive approach uses several small incisions rather than one large one. The surgeon inserts a camera and special instruments through these small incisions to repair the hernia from the inside. Mesh is often used to reinforce the weak area. This technique typically results in less post-operative pain and faster recovery compared to open surgery. However, it's not suitable for all hernias or all patients. So, while not all hernias require immediate treatment, knowing you have one allows you to monitor it and recognize signs of complications. Remember, if a hernia becomes painful, hard, or discolored, or if you develop symptoms like nausea and vomiting, seek emergency medical care, as these could indicate a strangulated hernia requiring immediate surgery. Now, we want to hear from you. Have you or someone you know ever had a hernia? What symptoms did you notice first, and how did you manage it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.